Good morning, everyone. Today we are going to discuss Super 50 high yield question from forensic medicine. Considering forensic medicine as a subject which contains about 10 to 15 questions in your competitive exams, so let us. ये आवाज आ रही है. चलो. Okay, so let us start with first question of today from forensic medicine. What, which of the following is a sign of anti-mortem hanging? Okay, so which of the following is a sign of anti-mortem hanging? So if you see options, first is pale ligature mark, second is salivary dribbling, third is absence of neck petechiae, and D is fixed lividity above the ligature mark. So what do you think will be the answer of this question? The answer will be salivary dribbling. Okay, so it is the most reliable sign of antemortem hanging. Okay, and why does it happen? It happens because of the active salivary secretion at the time of death. Active salivary secretion at the time of death. So, why does active salivary secretion at time of death indicate? What does it indicate? It indicates the viable circulation. Indicates viable circulation. So that is why salivary dribbling is considered as a reliable sign of antemortem hanging. Okay, moving on to next question. Pugilistic attitude. It is one of the most favorite question of examiners, where you will see pugilistic attitude. It is also known as boxer's stance. Okay, it is also known as boxer's stance. It is seen in mainly in death due to burn injury. Now, what is pugilistic attitude or boxer stance is? It is flexed elbow, flexion at the elbow joint, knees, and clenched fist. Clenched fist. So this attitude, this condition is known as pugilistic attitude or boxer stance. It is mostly seen in burn injury, death due to burn injury. Maybe this pen is not working. I'll sorry for the interruption. The pen is not working. Without pen, I cannot proceed. So, if we see death due to burn injury, there is a phenomena where there is a coagulation of protein which causes contraction of muscles, which causes this boxer stance, where there will be flexed elbow, knees, and clenched fist. So the answer for this question is C, death due to burn injury. Third question, third question is grease collar is seen in. So grease collar is also known as abrasion collar. And where will you see this grease collar? The answer will be the entry wound of firearm. Entry wound of firearm. Okay, is seen in entry wound of firearm. So basically, this abrasion collar or grease collar helps in differentiating between the entry and the exit wound. Okay, and you will see the abrasion collar in the entry wound, but you won't see abrasion collar or grease collar in the exit wound. Okay, and why does this abrasion collar happen? Why does this grease collar or abrasion collar happen? It is due to the the rubbing of bullet in the skin, which like the lubricants and the metal particles which penetrates the surface of the skin and causes this abrasion collar. So you have to remember abrasion collar or grease collar कहाँ मिलेगा? आपको मिलेगा entry wound of firearm, not the exit wound of firearm. Okay. Now this is also one of the used to be favorite question of examiners. Cafe coronary. Cafe coronary refers to cafe coronary refers to cyanide poisoning, sudden death due to cardiac arrest, sudden choking of food bolus, or sudden collapse in cafe. What is the answer of this question? What is the answer of this question? Is sudden choking of football. Sudden choking of footballers. Crazy physician is asking, it's for FMG, sir. Yes, yes, it is for FMG. It is for FMG. So all these questions which you are getting here are either previous year question or expected to come in your future exam. So these are basic questions which examiner ask around, 10 12 questions comes from forensic medicine in your FMGE exam, and the topics, most of the topics are repeated. Okay. So all these questions are either previous year questions or will come in your next exam. At least the topic, if not the exact question, but the topics will remain the same. So moving on, gutter fracture is commonly associated with. Gutter fracture is commonly associated with. Can anyone tell? Answer. Gutter fracture is, first option is blunt trauma. Second is incised wound. Third is tangential firearm injury. Fourth is fall from height. So this question was asked, I think, uh, fracture or depressed fracture was asked last to last year, or I think this question was there. So topics will remain same. Question, the you know the language of question can differ, but the topics will remain same. So gutter fracture is commonly associated with. So they saying A, they saying A. Most of you think it's A, and some of you thinks it's C. So I'll tell you, those who think it's C have already cracked your exam. You got your answer right. It is tangential firearm injury. So what happened here is, it is gutter fracture is basically, a groove or a channel in the outer table of skull, the outer table of skull. Okay, so it usually occurs when a bullet strikes the skull at an angle tangentially. Okay, and it creates a groove, or you can say creates a groove or channel in the outer table of skull. Okay, so how does this helps us to understand? What does it helps us to understand? It helps us to understand the direction, of the fire. Direction of fire helps us to understand the direction of fire. I'm seeing your comment on phone, so that's why I'm a little bit distracted. Okay, so gutter fracture is commonly associated with tangential firearm injury. It is basically when a firearm or bullet strikes at an angle and creates a groove in the skull, in the outer table of skull. And what is the significance of this? The significance is, it tells us the direction of fire, from where the firearm was used. Okay, next question. Now I'll tell you, this is very important question or topic. Should know everything about it. The best indicator of live birth in a neonate is middle ear hair, ossification center in bones, hydrostatic test positive, or meconium in gut. Best indicator of live birth in a neonate, I'll change a little bit, in postmortem examination. What is the best indicator? Answer is hydrostatic test positive. Now, what is hydrostatic test? It is lung rotation test. It basically tells you whether the lung is aerated or not. Lungs aerated or not. Now, lungs aerated means there was respiration, there was respiration. Okay, so if you want to differentiate between live birth or stillborn, or no, so what you will do, you will do a hydrostatic test. What we do is, take take out the lungs, we dissect the lungs, we take a piece of lung and put it in a bowl of water. If the lung sinks, like, then there is no air in the lungs. That means when the baby was born, there was no respiration. If at all there is respiration, there will be air in the lungs, and lungs will float over the surface of water. This is the basic simple hydrostatic test, and it tells you about whether the baby was live born or stillborn or dead inside the womb of mother. So hydrostatic test is the best indicator of live birth in neonate in postmortem. Now, this is a very simple question. Rigor mortis, rigor mortis begins in eyelid, lower limbs, fingers, or neck. Anyone wants to answer? So basically, why rigor mortis happens is due to the depletion of ATP. depletion of, okay, where in obviously in muscles, depletion of ATP in muscles. Okay. Rigor mortis happens due to depletion of ATP in muscles, which causes actin and myosin to remain in contracted state. Contracted state. And rigor mortis begins first from smaller muscle groups like there is eyelid. Now, moving on, lucid interval. Lucid interval is also very important question. Lucid interval. Where you will see lucid interval, or lucid interval is characteristic of epidural hemorrhage, subdural hemorrhage, intracerebral hemorrhage, or subarachnoid hemorrhage. Subarachnoid. What is the answer? Okay. Singer 99 is saying B. Sadesi is saying epidural. He's saying epidural. Okay. Okay, first tell me what is lucid interval? Yes, lucid interval. So basically, lucid interval is a transient recovery of unconsciousness, sorry, transient recovery of consciousness after being unconscious from trauma. पर्सन एक बंदे को ट्रॉमा हुआ, that person got unconscious. For some time, the person get conscious, then unconscious. This transient period is called lucid interval. Transient period is called lucid interval, and it is seen in epidural hematoma. Remember, remember, remember. Epidural hematoma. Now, epidural hematoma occurs due to which rupture of which vessel? Rupture of, सर थोड़ा स्पीड बढ़ाओ. ओके, स्पीड बढ़ा देते हैं भाई लोग. Epidural hematoma occurs due to rupture of middle meningeal artery. Middle meningeal occurs due to rupture of middle meningeal artery. Moving on, Langer's line are important for what are Langer's line and what is the importance of Langer's line? Langer's line are basically the line of skin tension which are due to collagen fiber orientation. So what is the importance of Langer's line? Langer's line importance is, the answer is wound gapping. So there are arrangement of collagen fibers in your skin. The orientation of these collagen fibers causes these Langer's line. Okay, and the importance of this Langer's line will be seen in wound gapping. Remember the answer. Now moving on, all are features of hanging except pale face you will see in hanging. Fracture of hyoid bone can happen, although it is not very common, but fracture of hyoid bone can happen. Prominent ligature mark obviously you will see, and fracture of vertebra. Fracture of vertebra is not the feature of hanging. Okay. Now there is one type of hanging, judicial hanging, where you will see fracture of cervical vertebra C2 and C3. Okay. In suicidal hangings, fracture of vertebrae is very uncommon. Is very uncommon. Okay. Moving on. Choking of firearm barrel leads to choking of firearm barrel leads to what? Increase in pellet spread, decrease in range, increase in muzzle velocity, or better shot concentration. Choking of firearm barrel leads to better shot concentration. So what this choking means? So you have two end of firearm. So the muzzle end. What does choking means? When there is constriction at the muzzle end, constriction at the muzzle end, it reduces the speed of the pellet, which results in more concentrated pattern of spread. Okay. Now it increases the accuracy, especially in longer ranges, and enhances the performance of firearm. So choking is what is the constriction of muzzle end, which increases the accuracy and decreases the the spread of pellets, and it helps in better shot concentration. So answer is better shot concentration. Moving on. Burking. Burking is a combination of, can anyone tell? Burking is a combination of smothering and traumatic asphyxia. It is a homicidal method where smothering and traumatic asphyxia both are used to kill a person, and this is known as burking. This is known as burking. Now, what the examiners will do, they will give you a photograph and they will ask what kind of torture method it is, or they will ask simply burking is a combination of what, or the topic will remain same, the language of question can change. So burking is a combination of smothering and traumatic asphyxia. Is a homicidal method where there is simultaneous smothering, that is closure of mouth and nose, and traumatic asphyxia means compression of the chest. The person will sit on the chest and smother, and this is called burking. Marbling is due to marbling is due to putrefaction. This is a very simple question, and you should know what marbling is. Marbling is due to putrefaction, and marbling is blackish. Marbling is due to greenish. Marbling is greenish black discoloration of superficial veins, and it is caused by putrefaction. Okay. In firearm injury, tattooing is caused by firearm injury in tattooing is caused by gunpowder particles. Okay. Tattooing is also called stippling, and it is caused due to unburned or partially burnt gunpowder particles. Okay. Moving on. Test to differentiate between seminal fluid and other body fluid. Okay. Some of us are saying to increase my speed, so I'll increase the speed. Test to differentiate between seminal fluid and other body fluid is Florence test. Florence test. What does Florence test do? It detects choline. Okay, it detects choline, which is a component of semen. Okay, so Florence test differentiate between seminal fluid and other body fluids, since semen contain choline, and Florence test detects choline. Okay. Ossification center used in fetal age estimation. Ossification center used in fetal age estimation. The correct answer here will be lower end of, okay, lower end of femur. The appearance of ossification center at the lower end of femur, or you can say distal femoral epiphysis, is a reliable indicator of fetal age. Now it appears typically at the age of 30 week of gestation, and it is used to determine viability. Okay, it is used to determine viability. The last sense to be lost before death is last sense to be lost before death is hearing. Hearing is the last sense which is lost before death. Okay. Which of the following is not a feature of homicidal hanging? Again, hanging is an important topic for you guys. So many questions can be asked from this topic. Which of the following is not a feature of homicidal hanging? Feet touching ground, absence of salivary dribbling, ligature mark at the high neck, or multiple knots. Answer will be ligature mark at higher at the neck. Okay. So there are different type of hanging: typical hanging, atypical hanging, and other things, which you will read briefly. For now, the answer of this question is ligature mark higher at the neck. In judicial hanging, death is due to asphyxia, carotid compression, fracture, dislocation of cervical vertebra, or vagal inhibition. I have already told you it is fracture, dislocation of cervical vertebra, mainly C2C. Okay. Fingerprint system was introduced by. Sometimes they ask very specific question, which if you know, you know. If you don't know, you cannot answer them. So this is one of that type of question. Fingerprint system was introduced by Edward Henry. Remember this. Okay. Edward Henry developed the Henry classification system and modern fingerprint identification system. Remember this. Fingerprint system was introduced by Edward Henry. So next question is, primary identification of tattoo removal in forensic cases is. Primary indication of tattoo removal in forensic cases is, for example, a person was having a tattoo, he was a criminal, and after doing the crime, to आइडेंटिटी छुपाने के लिए उसने टैटू रिमूव कर दिया. बट हाउ, व्हाट इज़ द प्राइमरी इंडिकेशन? आप कैसे पता लगाएंगे कि टैटू था या नहीं? व्हाट इज़ द प्राइमरी इंडिकेशन ऑफ टैटू रिमूवल इन फॉरेंसिक केसेस? इज द आंसर इज, sorry, I think this question has problem. I'll skip this question. I'll get back to you. I'll get back to you. Okay. So next question is, postmortem lividity helps in. Postmortem lividity helps in estimating time of death, cause of death, manner of death, or all of the above. It helps in estimating all of the above. Postmortem lividity is also known as liver mortis. Liver mortis. Okay. And why does it happen? It happened due to gravitational pooling of blood after death. Gravitational pooling of blood after death. Okay. So postmortem lividity helps in estimation of death. It happens after, it starts within 30 minutes. It extend up to 6 hours. It get fixed in 6 hours. So it helps in estimation of death. It helps in estimating cause of death. In many cases, like in carbon monoxide poisoning, the lividity of the deceased will be cherry red in color. So in that way we can identify, just by seeing the deceased, we can identify what kind of poisoning was it, or what kind of what was the cause of death. And in manner of death also, PM lividity is very helpful. Okay. So all of the above. Most reliable method for sex determination from skeleton in forensic anthropology. What is the answer? Skull morphology, or pelvis, or mandibular angle, or long bone? The most reliable method for sex determination here is, anyone want to answer? Pelvis morphology. Pelvis morphology. So the accuracy is 95%. Pelvis. Moving on, the presence of ethmoid hemorrhage is most consistent with anaphylactic death, drowning, smothering, or manual strangulation. ethmoid hemorrhages आपको कहाँ पे मिलेंगे? Answer is smothering. Okay, answer is ethmoid hemorrhage होता कब है? It is due to the trauma and venous congestion during smothering. Although it is very rare, but it is suggestive of smothering and congested internal bleeding. And ethmoid hemorrhages are mostly seen in smothering. Moving on, in the context of firearm injury, internal ricochet is referred to. What does internal ricochet refer to? It is bullet impacting bone and deflecting internally. When bullet after striking the bone, it internally deflects. It is internal. So remember, internal ricochet is bullet impacting the bone and deflecting internally. Now, cherry red postmortem lividity is characteristic of, told you now, carbon monoxide poisoning. Carbon monoxide poisoning is due to its causes cherry red postmortem lividity. Moving on to next question. Lead poisoning presents with all except. lead poisoning में आपको क्या क्या मिलेगा? Now see the option: Burton's line, basophilic stippling, encephalopathy, and Mees line. The answer of this question will be Mees line. You'll in lead poisoning there will be Burton's line, basophilic stippling, encephalopathy. But Mees line is seen in which poisoning? It is seen in arsenic or helium poisoning. Arsenic and helium poisoning. What is Burton's line? Burton's line is bluish black line in your gum mucosa. Basophilic stippling occurs in RBC, and encephalopathy is also seen in lead poisoning, especially in children. These are all hallmark sign of lead poisoning except the Mees line, which is seen in arsenic poisoning. Moving on, mouthwash odor is characteristic of. Mouthwash odor is characteristic of isopropyl alcohol. Isopropyl alcohol has fruity and acetone-like odor, and it is mostly described as mouthwash odor, and it is used in rubbing alcohol, and it can cause, if there is poisoning due to isopropyl alcohol, it can cause CNS depression, hypotension, and ketosis. Okay. Organophosphorus compound causes death due to. This is very easy, and this is very common question asked by examiners. Can anyone? Dr. Mehboob is saying thoda time to do, sir. Sir, many of you are saying thoda jaldi karo. That's why I was going a little bit fast. So I'll ask if anyone has any doubt till now, any question to ask, anything you want me to explain more, or you want me to repeat any question. Give you 2 minutes. Can tell me if you want to go back and ask me any question regarding any topic. Any doubt, anyone? Dr. Mehboob, any doubt? Any you want to ask something more? Can I proceed now? Okay. Organophosphorus compound causes death due to, some of you have answered correctly, is respiratory paralysis. Is respiratory paralysis. Okay. BNS. So they see BNS. Okay, BNS. There is a different separate session for BNS, guys. Organophosphorus compound, what they do, they irreversibly inhibits the acetylcholine esterase. Acetylcholine esterase. Acetylcholine esterase, which leads to accumulation of acetylcholine. Acetylcholine causes cholinergic crisis, which causes symptoms like bronchoria, bronchospasm, paralysis of respiratory muscles, which causes respiratory failure, obviously. So organophosphorus compounds can cause death due to respiratory paralysis because it inhibits acetylcholinesterase, which causes increase in acetylcholine, which causes such symptoms and causes bronchospasm and respiratory failures. Now, all are feature of aconite poison except tingling is a feature of aconite poison, sweating is a feature, hypotension is a feature, but hyperthermia is not the feature of aconite poison. Moving forward, aconite is a cardiac poison and death is mainly due to cardiac failure. So tingling, sweating, hypotension, arrhythmias, all such symptoms occurs in aconite poison, but and death occurs due to ventricular fibrillation, causes cardiac failure. Hyperthermia is not seen. Formalin is best preserved in. This is a wrong language of the question. I'll tell you, tissues which are fixed in formalin are best preserved in. This is the question, has been asked previously. Tissues which are fixed in formalin are best preserved in saturated saline. Saturated saline. Miosis is seen in poisoning due to. This is also a favorite question of examiner. Mydriasis and meiosis, they asked many questions. Last time they asked from mydriasis. So meiosis is seen in poisoning due to opioids. Opioid toxicity is characterized by triad of meiosis, then respiratory depression, and okay. So in opioid there will be constriction of pupil causing meiosis. It is seen in opioids. In all other there is mydriasis. Antidote of benzodiazepine overdose is flumazenil. Flumazenil. Okay. Antidote of benzodiazepine toxicity is flumazenil. Flumazenil is a competitive inhibitor of or antagonist of GABA A, benzodiazepine receptor. So what does it do? It reverses the sedation and respiratory depression and It is an antidote of benzodiazepine overdose. Moving forward, Widmark formula is used to calculate what? It is used to calculate alcohol concentration. Widmark formula calculates blood alcohol concentration, or AC. It is used to calculate the amount of alcohol consumed. Okay. Mac even sign is seen in. Is very simple question. Mac even sign is seen in. What is Mac even sign? Mac even sign refers to tremors or fluttering of eyelid. Fluttering of eyelid when the eyes are closed. When the eyes are closed, there will be tremors and fluttering of eyelids. It is known as McEwen sign. It is observed in chronic alcoholic people. Chronic alcoholic people. So McEwen sign is seen in alcoholism, where there will be tremors and fluttering of eyes when the eyes are closed. Now, dialysis is effective in all except. Dialysis is effective in all except methanol poisoning, barbiturate poisoning, benzodiazepine poisoning, or salicylate poisoning. The answer is benzodiazepine poisoning. Since benzodiazepines are highly protein bound and lipid soluble compounds, highly protein bound and lipid soluble compounds, so they are very poorly dialysible compounds. So dialysis is not very effective in benzodiazepine poisoning. So in benzodiazepine, what is the antidote which we discussed 2-3 questions back? Is fluma is flumazenil. Okay, this flumazenil is a GABA A receptor antagonist. So moving forward, fetal dose of cyanide is approximately, answer is 50 milligram. 50 to 60 milligram of cyanide can be fatal. What does cyanide do? Cyanide inhibits the cytochrome oxy in mitochondria. So what does it do? It halts the cellular respiration and causing what type of hypoxia it causes? It causes histotoxic hypoxia. That is due to cardiac or respiratory arrest. So the fatal dose is 50 to 60 milligram. Arsenic resembles which disease clinically? The symptoms of arsenic poison resembles a disease. What is that disease? Tuberculosis, cholera, dengue? It is cholera. Okay. In acute arsenic poisoning, there is profuse watery diarrhea. Okay, or rice water stool. We can say rice water stools. There will be hypotension. There will be vomiting. So all these symptoms, they mimic cholera. So arsenic resembles cholera. Opiate overdose causes. Opiate overdose causes one, miosis. It causes opioid poisoning causes miosis and bradypnea. So the answer is bradypnea and miosis. What is the antidote of opioid poisoning? Antidote of opioid poisoning. Remember, naloxone. Moving on. Alkalization of urine helps eliminate what? Alkalization helps in elimination of salicylates. Helps in elimination of salicylates because salicylates are acids. Alkalization of urine in their ionized form, which is less reabsorbed in renal tube, and they eliminate. So alkalization of urine helps in eliminate salicylate because it is a weak. Now Monday disease occurs due to nitroglycerin poisoning. Nitroglycerin poisoning. So workers who are working in factories or industries get exposed to nitroglycerin during weekdays and they develop tolerance. So on weekends, when there are withdrawals like vasospasm and headaches, which are called Monday disease due to recurrence after the break they got in. So it basically occurs in those people who are working in industries which deals with nitroglycerin. So Monday disease is basically due to the withdrawal symptoms which occurs uh, like vasospasm and headaches. Monday disease is related to nitroglycerin. Just remember. Now, Hutchinson teeth are seen in which kind of poisoning? Hutchinson teeth is seen in which of the following? Sorry, fluoride poisoning, mercury, lead, or congenital syphilis. Teeth is seen in congenital syphilis. This question has been asked multiple times in your exams. Now, you can consider either from pediatrics or from forensic, whatever it is. Congenital syphilis is a hot topic, and Hutchinson's teeth are seen in congenital syphilis. So basically, what is Hutchinson teeth? It is notched, peg-shaped upper central incisors, which are seen in children who are peg-shaped upper central incisors. They are seen in congenital syphilis. There is one triad of Hutchinson triad, also an important topic. Hutchinson's triad is Hutchinson teeth, interstitial keratitis, and deafness. This is Hutchinson triad: teeth, uh, keratitis, and deafness. Eyes and ear both are affected in Hutchinson triad. Fatal dose of strychnine. Fatal dose of strychnine. S for S, the spinal poison. What is the fatal dose? Fatal dose is 30 grams. 30 grams. 30 to 50 on average is the fatal dose. If they ask specifically, it is 30 milligram is the fatal dose of strychnine. Strychnine, what does it do? Strychnine acts in on spinal tightened by antagonizing glycine receptor. It inhibits glycine receptor. Okay, a urine test for marijuana detects what? X, THC, CO. Any doubt till now? 30. Question number 30, Dr. Mehboob. Okay, you're answering the little. A urine test for marijuana detects tetrahydrocannabinoid COH. Okay. It remains in the system longer than THC, so this is the answer. THC and THC which both are correct, but the specific answer, the most correct one is is THCCO because it remains in the system for a longer time. Snake venom is primarily composed of what? Alkaloids, protein enzymes, carbohydrate, lipids. It is basically composed of protein and enzyme. So it can contain complex of protein and enzymes like phospholipases, neurotoxins, and toxins. Fossy jaw. Fossy jaw is associated with yellow phosphorus. Yellow phosphorus. Chronic exposure of yellow phosphorus causes fossy jaw in like workers who are working matchbox industries and factories. So it leads to the mandibular osteomyelitis, which is fossy jaw. So, osteomyelitis of mandible is fossy jaw happens in yellow phosphorus poisoning. Neurotoxic snake is viper, great Russell's or saw-scaled viper. Great is the neurotoxic. What does it do? It causes respiratory muscle paralysis. Whereas you see viper is mainly hemotoxic or toxic. Arsenic is best detected in. It is has been asked multiple time and very easy. Worker confusing. What is the confusion, Dr. Mehboob? Can you ask? What do you want to revise? Okay. If you want to ask anything, Dr. Mehboob, please tell. Otherwise, I'll move forward. So basically, when we discuss, high yield question, so what is the basic purpose? The basic purpose is these 50 questions or these 50 topics are the most important topics for your exam. So if I have a if I discuss everything right here right now, it will take much more time. So what you can do is you can take all these questions, you can take out the topics and you can revise, because from experience I can tell what kind of question they are gonna ask in your exam. Okay. And okay, all snake bite is a topic of discussion for like 1.5 hours. Okay, I'll try. Let, let me just finish. You guys also want to discuss BNS and all, so we can do it. For now, let's see this question. Arsenic is best detected in which? Sample: blood, urine, hair and nails, and liver. Answer for this question is hair and nails. So let me tell you, arsenic is has a very high affinity for keratin. Okay, so it gets accumulated in places where there is high concentration of keratins like hairs and nails. And these can be analyzed weeks after exposure, like which is useful in chronic poisoning. Now, pralidoxime is used in which? It is very easy question. It is used in organophosphorus poison. Now, what does organophosphorus do? It inhibits acetylcholine esterase, which increases the acetylcholine and which causes symptoms of acetylcholine crisis. So, what does pyridoxine do? It reactivates the acetylcholine esterase by removing the phosphoryl group which is attached to organophosphate. So it is used along with atropine in organophosphorus poison. So it is, what does it do? It reactivates acetylcholine race. It is used along with atropine, atropine plus ralidoxim. Parkinsonism is seen with chronic exposure to what? Manganese. Manganese, chronic exposure to can cause Parkinsonism. Why? Because manganese toxicity, it affects basal ganglia, especially what? Globus pallidus, which causes Parkinsonism or Parkinson-like symptoms such as tremors, rigidity, and gait disturbance. It is also termed as mang. So, chronic exposure to manganese can cause symptoms like tremors, rigidity, and gait disturbances, which are like Parkinson like symptoms. What does it do? It affects the basal ganglia, globus pallidus basically, and it causes such symptoms, and it is known as manganism. Okay. It is known as manganism. Any doubt till now? We have discussed around 50 questions because some of you wanted to do it faster, so I was a little bit fast. If you want to ask any question, any doubt, you can ask me right now. Okay, you guys want to discuss about BNS? Should I discuss briefly? Because there may be question from BNS. हाँ, वो एक क्वेश्चन जो मैंने छोड़ दिया था डॉक्टर महबूब, आई थिंक द लैंग्वेज एंड द क्वेश्चन इज not correct, and it's I think it's better to leave that question than to see it wrongly. So okay, you can leave that question, no problem. Okay. So what I'll do, we will revise BNS a little bit. Then Dr. Mehboob wants एक टॉपिक याद नहीं रहते थोड़ा. Okay, we can see that also, but I'll tell you some important uh, points on BNS, some important sections which can be asked. Okay. So initially or before BNS there was IPCs. So IPCs has been changed to BNS. CRPC has been changed to BNSS, and IA, Indian Evidence Act, has been changed to Bharatiya Sakshi Act, BSA. Okay. So if you see important sections of BNS, so first, the foremost important section of BNS is BNS 2. It has 3 subsections. Okay. Subsection 6, subsection 14, and subsection 17. Subsection 6 defines death. Subsection 14 of section 2 defines. Subsection 17 of section 2 BNS defines. Okay, remember this. Now there is BNS section 20 of BNS. What does section 20 of BNS says? Child under 7 years is not responsible. Not responsible criminally. Okay. 20 BNS says child under 7 years is not responsible criminally, or there is no criminal responsibility. 21 BNS says 7 to 12 years. Now the criminal responsibility will be decided by court. 24 and 23 and 24, if there is a crime committed by involuntary intoxication, किसी ने intoxicate किया और ने crime किया, then not criminal responsibility. Voluntary intoxicate करके आपने शराब पी के किसी का मर्डर कर दिया, you will be punished. These are 4 important BNS related to criminal responsibility. Now 63 BNS, definition of rape. Minimum age of girl for consent of sex is 18. 64 is punishment of rape. Can vary from 10 years to life imprisonment. So 63 and 64 PNS are related to rape. 63 defines rape, 64 punishment of rape. 70 BNS defines gang rape of more than 18 years. Punishment is 20 years till, and if less than 18 years, then life in prison. Or okay, 80 BNS is dowry death. See, BNS is dowry death. And what is dowry death? Death of a woman within 7 years of death of a woman within 7 years of, and the punishment is 7 year to life in 7 year prison. One 114 BNS is definition of hurt. Okay. 115 BNS is voluntarily causing hurt. Voluntarily causing hurt. 116 BNS is important. It is definition of he is hurt. Okay. 117 is voluntarily causing grievous hurt. 118 for grievous hurt by dangerous by dangerous. Okay. Give you some important BNS also. What is 2 BNSS? CRPC has been changed to BNSS. BNSS 2 BNSS includes various definitions of various type of offense which are billable or non-billable. 33 BNSS is information to police about the crime. About the crime. 51 BNSS is important for you. Is medical examination of a arrested person of any offense. Although forceful examination is not, is also allowed. Forceful means not beating that person. So if a person is arrested and brought to you by a police, you have to examine that person under 51 BNSS. Okay? Medical examination of arrested. Now 52 BNSS says medical examination of arrested person which is accused of rape. Okay, accused of rape. So 51 and 52 BNSS are important for you. Defines medical examination of arrested person of any of it. 194 BNSS is police inquest, and 196 BNSS is magistrate. So these are some important BNS and BNSS which you have to remember correctly. Okay. When is your exam? FMG exam? Anything else you want to discuss except long topics which we cannot discuss here because not a prototype class which I am taking right now. I can discuss small things or latest edition if you want to. 26, what 26? July, okay. So you have multiple other things to revise. So what I will suggest is you revise these topics which I have discussed. Do not try to cover every other things. Okay. Method to detect age by transparency. Okay. So basically, you guys uh, need more times. You have 19 other subjects to revise. What I have given here is the important topics which you can go and take out your time and revise. And all the best for your exam. And I hope everyone will do great. Do not waste your time in revising those things which are not important. Revise those things which are going to cover your, 70, 60 to 70% of your exam. You have to qualify first. Rank come after that. So all the best. Take care. Bye bye. And if you have any other doubt, if you want to ask anything, you can contact me. WhatsApp. Can give you your number. Okay. Can ask any WhatsApp. Okay. So now I'll take your leave, and I think you have written the number. I'll Okay. Bye bye. Take care.